Welcome to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is also Dr. James Bridger, who is our Deputy Health Officer. Reporters, all of you should have already permission to record. If you do not, utilize the chat to request it. And with that, I go to you, Mr. County Executive. We do have a hard stop at 1:25 p.m. Mr. County Executive. Mr. County Executive?
His screen appears to be frozen. Let's see if it clears up.
So can you all hear me? Looks like.
Your audio is breaking. We understand you're remote today. Perhaps bad connection, obviously. Should we get started with the update from Dr. Bridgers? Dr. Bridgers, are you ready?
So good morning.
Good afternoon. Good afternoon.
Hopefully you can hear me. That's kind of my space.
We hear
today.
you.
It's been kind of
oh, there is a county executive. I think he has a better connection now.
I will.
Can you please unmute Mr. County Executive? Unmute.
Take myself off mute and
there you
try
go.
to get back to what I had up on my screen. I'm sorry about that. That was very strange.
It's freezing again.
Bear with me a second here. It's freezing again?
You're good now. It's rolling.
Okay. So first of all, good morning or good afternoon, everybody, and thank you for joining us for our weekly press briefing. I'm talking to you today from the Maryland Association of Counties Convention in Ocean City, fresh from a meeting with the Department of Transportation in the state. We're going to get into our COVID status briefing shortly, but I want to start by just updating people on the resignation this morning of Dr. Gales. I know some people, just to start with, have said, why did you get the email at 3 a.m.? Because when he wrote it, actually 9 a.m. So he wrote it when he got up in the morning, so it's not something right at 3 a.m. because it was written at 3 a.m., just to clear that up. Dr. Gales informed me and the council this morning that he'll be stepping down from serving as the county's health officer on September 12th. Dr. Gales is going to go down as probably one of the most important leaders at one of the most critical times in the history of our county. His leadership, his strength and compassion as a health officer during our county's most significant and our country's most significant health threat was incredible. I'm really thankful to his service to the residents of Montgomery County and my administration. I worked very closely with him, and his guidance was just essential to getting us to making the right decisions here. As we've been going through all this, I know it's been important for people to hear from the health leaders on the front lines of this fight. That's why Dr. Gales has always been. I also think he's a true profile and courage. He has pretty much gone through hell over the last 18 months. He is, I think, as many people know, he's a joint appointment of the governor and the county, and he's had to fight with his other boss for mostly the duration of COVID. He has had to answer and respond to every question, every recommendation, every issue from myself, the county council, our state and congressional delegations, our hospitals, our faith community, our community groups, associations, as well as our residents and businesses. He has absorbed
We apologize for that. Okay,
from parts of the public, including threats to safety, racist and homophobic email, and social media attacks. And yet it was his recommendations and his consistent guidance on the best public policy and health practices that has enabled us to be one of the.
We apologize for the poor signal. As you heard the county executive, he is outside the jurisdiction attending this event. There he is again.
And heroic. I look forward to his return from community and
Mr. County Executive, you're frozen again. We cannot hear you. Obviously, is a very poor connection. There you are. You need to unmute, Mr. County Executive. Please unmute. You need to unmute. You're muted, Mr. County Executive. There.
I don't know if you got most of that. And I get it.
The audio is in and out. Mhm.
So let me try this by phone. And I think that'll make it a lot easier. I wish I could do this, but the connection here is not very good. So I want to be everybody to hear what I do. A quick dial in, and when I dial in, I'll drop the current way of doing this. So hang on a second.
Again, we apologize for the poor connection. Thank you for your patience, reporters, members of the media, and you who are watching, county residents.
Here I am in a modern building in the 20th century, 21st century, and the Wi-Fi is not up to snuff here. Where?
Mr. County Executive, since we have a hard stop of
Yes.
1:25.
I'm trying to get this thing.
Should we get rolling with
Talk to
Dr.
you in a way
Bridgers?
you guys can hear.
Dr. Bridgers, why don't you go ahead and do your presentation, see if we can get the county executive connected with better audio.
Sure. Good afternoon, all, and I thank our county executive for asking me to provide the COVID-19 update this afternoon. I will be very brief due to the interest of time. Our numbers continue to trend in the correct direction. We're at 2.93 for our test positivity. We continue to monitor it on a daily basis, and based on our Board of Health regulation on a 7-day average of those numbers, and they tend to be trending. We're still at a substantial transmission rate, as you see here, but the substantial transmission rate for our case rate is 10.36. When we go under 10, we will be back at a moderate transmission rate that is consistent with what we're seeing at the CDC as we track their numbers as well. We continue to monitor the data. We have about 74,000 cases and 110 cases today. Again, we continue to vaccinate about 5,000 folks a week, and we testing about a similar 4,500. And so we continue to provide shots in arms for individuals, and we thank all who come to our 3 static sites. As we look at our hospitalization and our breakthrough data, the number is still small. We're looking at 910 individuals who tested positive and were vaccinated out of 2,226 cases. That's 1.09%. And of those, we're looking at 88 hospitalizations, 30 were vaccinated, which is even a smaller percentage, 0.004. We're seeing those hospitalizations still in the age category between 20 to 39, and individuals who are older, our senior population, and we continue to monitor the data, the hospitalizations. We are in conversation and have discussions with our hospital partners regarding any surge or any emergency room visits that we see may impact individuals or our case count individuals who have COVID or flu-like symptoms, and we continue to monitor that. Again, this is our slide regarding that. Now I'm going to stop sharing and just briefly talk about our vaccine plan. We presented Mr. Elrich with our vaccine plan for our third shot. I know folks call it a booster, but it's our third shot, our guidance for those individuals who the FDA and the CDCs have identified as immunocompromised. Our guidance that we will be meeting this afternoon at 2:30 with the Maryland Department of Health is based on that. The guidance is based on CDC's guidance with our interpretation based on the data, and we're waiting for guidance from MDH. First and foremost, people should talk to their healthcare provider if they feel that their medical condition falls within this category and whether or not an additional dose is appropriate for them. The immunocompromised would include those individuals who are 12 years and older and receive a Pfizer vaccine, or those individuals who are 18 and older and can receive a Moderna vaccine. Based on the guidance to CDC that we're having, the third dose should be the same mRNA vaccine as their primary series. Based on our population and sample size, the CDC said about 7 million folks fell within this category based on our initial data analysis and surveillance data and what we are tracking in our state system and in PrepMod and Immunet. About 2.7% of the population in Montgomery County is immunocompromised, which is about 27,000 individuals, going back to our phased approach where we identified them in a categorical space. Now, keep in mind, that data is still being analyzed. We currently have 23,658 combined doses of the Pfizer and the Moderna vaccine. As of yesterday, our immunization team met with MDH. Their PrepMod system now has a third shot identified in the system, and we will be setting up clinics to begin vaccinating, if not the end of this week, the beginning of next week. We will present all of these data points to the Maryland Department of Health when we speak with them this afternoon. And lastly, the question may come up is how will those individuals receive notification? And similar to our current operations, we have a system in place where those individuals will receive an email via our C19 vaccination at Montgomery County, Maryland.gov, regarding their eligibility and or the recommendation based on those eligible conditions. I will not go into all of those eligible conditions, but just briefly, individuals who have active treatment for tumors, recipients of organ transplants, stem cell transplants, severe primary immunodeficiencies, individuals who are HIV, have untreated HIV, and individuals who are on high dose corticosteroids treatment. I will stop there and turn it back over to you, Lorna, or the county executive for his additional remarks. Happy to answer any questions, and thank you again.
Thank you, Dr. Bridgers. Okay. Do we have the county executive via telephone? Mr. County Executive, have you been able to join us?
Can you hear me?
Yes, we can. Thank you.
Okay, I may appear on screen as Scott, so I'm using his phone. Okay. He can't get video on his phone, and obviously my computer's not getting a good enough signal. So I'm going to start again. First of all, thank everybody for coming here. We're going to talk about the COVID status shortly. I just want to begin by talking about the resignation of Dr. Gales this morning. First of all, I wanted to let people know that people ask the question, why 3 a.m.? And the answer is 3 a.m. because where he was, it was 9 a.m. when he sent the message to the county. So he's on vacation, and it wasn't a 3 o'clock in the morning message. It was a 9 a.m. in the morning message. So we were informed, this morning by Dr. Gales, and the council was as well, that he'll be stepping down from serving as the county's health officer on September 12th. And I believe Dr. Gales is going to go down as one of the most important people in our county's history. His leadership and strength and compassion as our health department officer during this, probably the most significant public health threat any of us have ever experienced, has been remarkable. And I'm thankful for his service to the residents of Montgomery County and to my administration and to me personally. I relied on him heavily. We spent a lot of time talking about decisions that would be made, and I had complete confidence and continue to have complete confidence in the leadership he provided and the direction that he helped to lead the county. I also think Dr. Gales has been a true profile and courage. He's gone through hell over the past 18 months. And the first is he's had to fight with his boss, who's the governor. He advocated policies that were often opposed to what the governor was advocating. And I don't know if most people realize this, but the health officer is actually a joint appointment of the county and the governor. And so to be at odds with your boss is not always an easy thing to do. To be at odds with your boss in a high profile situation for 18 months is probably an extraordinarily difficult thing to do. But that's one of the things I really appreciated about Travis, having the courage to tell us the right thing and not the political thing, and being willing to do that, knowing that he was making one of his bosses very unhappy. He's had to respond to every question, every recommendation, and every issue from myself, from the county council, from our state and congressional delegations, our hospitals, our faith communities, our community groups and associations, as well as businesses and residents. And he absorbed the torrent of hate and vitriol from segments of the public, including receiving threats on his safety, racist and homophobic emails, and social media attacks. So he just didn't get to be the doctor, but he was attacked in unprecedented ways throughout this. Yet it was his recommendations and consistent guidance on the best health practice that actually enabled us to be one of the safest large jurisdictions in the country in combating COVID. I look forward to his return from vacation and hope the council, our state and congressional delegations, and everybody in Montgomery County will join us in thanking him and wishing him well on his future endeavors. We're fortunate that we have a strong team in the Department of Health and Human Services, the Division of Public Health Services, the Board of Health, and across my administration. It's in order to be able to continue our response and recovery efforts. Dr. Raymond Crowell will immediately begin working with the Maryland Department of Health on filling this important position. I want to be clear about one thing. We're not going to accept the new health officer from the state who's not going to lead from what the science and data show. We are not going backwards, and we're not going to a health officer who does not respect the science and data. And, you know, if I could clone Dr. Gales, I would. But whatever we are going to get is going to be somebody who can demonstrate the same kind of leadership and courage that Dr. Gales was able to demonstrate, and to be independent, which is the most important thing. Now a little bit more on our COVID update. This week, our test positivity is at 2.93, and our case rate is 10.36 per 100,000. We had 110 new cases yesterday and no deaths. And we continue to see our rate fluctuate from high double digits, 80s and 90s, into the low 100s. And so they're bouncing back and forth right now. The number of COVID cases continues to be a level of concern as we remain a community in substantial transmission by the CDC guidelines. And this means the indoor mask mandate is going to remain in effect in Montgomery County. Hospitalizations and deaths continue to be primarily impacting people who are unvaccinated. Out of 1,500 people, over 1,500 people in Maryland who've died from COVID-19 since the end of January, 96% were unvaccinated and only 4% were vaccinated. 96% unvaccinated. There's no better reason than this statistics for anyone unvaccinated to make the decision to get vaccinated. Currently, 72.1% of our total population has received both doses of Pfizer and Moderna or single dose of J&J, according to the CDC data. We continue to lead the nation with 85% of our eligible population, meaning 12 and older, fully vaccinated, and 93% of that population have had at least one dose. At the same time, we continue to vaccinate more people, more than 5,000 in the past week, especially people aged 16 and 39, which is good news. More people are also getting tested, and testing continues to be important but getting vaccinated is, of course, the best way to stop the spread of the virus. With school starting on August 30th, we have to do everything we can to protect our students, parents, and staff for the virus. We need to reduce the opportunity and possibility for outbreaks in our schools. So if you're returning from vacation, whether or not you're vaccinated, please get tested. We do know that the test that you do get breakthrough cases among vaccinated people, and that they carry the virus and they can still infect other people. So please get tested if you're coming back from having traveled other places. Remember that the Delta variant is highly contagious, can be transmitted to vaccinated people and by vaccinated people. And if you're unvaccinated, get the vaccine. MCPS put a great deal of time and effort into reopening schools. The public wants the schools reopened. The last thing we need is waves of COVID sweeping through our school population. You can get this shot at our county clinics, our pharmacies and hospitals, and so many other places. There's no excuse for not getting it. Just go to the county website to find a location near you. As Dr. Bridgers pointed out, the CDC is announcing this week that booster shots or third shots will now be required 8 months after individuals are fully vaccinated. It's been a focus of much discussion, and we've been talking about this for a long time. I understand that if you're like me and you've been following the nearly daily pronouncements about when and if you're going to need this third dose, it can be kind of confusing. I'm glad that the science has finally been settled enough that they're going to move in the direction of announcing a program for third vaccinations. Montgomery County, fortunately, this is going to be, I'll say, less chaotic than what it was like in the spring when everybody was trying to get vaccines and we only had a very limited supply of vaccines. Basically, 8 months after you were vaccinated is the month that you will be looking at getting your third shot. And so people won't be clamoring just because they're eligible for a third shot until the month in which they're eligible. And it gives us an opportunity to plan. We're going to need cooperation from the state so that we're able to plan not just Montgomery County, which provided a lot of the shots, but also the private providers, the hospitals, the pharmacies, the grocery stores. So we're working on our plan. We know we've got folks' emails, you'll be getting notices from us, and hopefully this will be executed in a much calmer way than it was during the spring. Governor Hogan is having a press conference this afternoon, and we're expecting him to adjust this plan, though so far we haven't actually heard from him about what he's going to say. I also hope that he'll adjust not our growing COVID rates and especially the places like Ocean City where there's no mask mandate. And the other thing we're hoping he will think about is his decision to end the eviction moratorium. It's a decision I disagree with. I've talked with his staff. We clearly have different opinions about this, but anybody who's gone out and tried to go to a restaurant knows that they're not using the hours they used before. They're not using the number of employees that they used before. Even if you go to a restaurant, you don't see the restaurants full like there were before by and large. So the demand for labor, despite people having some problems hiring, they're still not operating at full capacity. There's still a reluctance of people to go out. And I'm hoping that as the situation improves for most people and most people get vaccinated, we can improve people's levels of comfort, which gets to the next thing I want to talk about. Is last week I mentioned my interest in a regional vaccination passport. The Council of Governments met and are currently reviewing logistics and feasibility of a program. We're not going to do it by ourselves, but I was pleased to see that some Montgomery County businesses have begun to require proof of vaccination on their own or regular testing. We got a notice yesterday from AFI that they're joining, I think, over 20 local entertainment venues to restrict entry to their venues to people who either have a test within the last 72 hours or can show proof of vaccination. I think this is really important. I think particularly in places like restaurants and movies and entertainment venues where people gather together and drink, and lots of time when you're eating, you're barely wearing a mask. That by doing this, it'll create a greater sense of safety for the customers. And I think that the greater sense of safety is what people are needing and wanting before they come back. So I applaud the businesses for attempting this. I look forward to seeing the results and the response from the patrons. I understand some people object to the choice of mandatory vaccination or testing. They don't seem to like either, and often arguing that getting vaccinated is a personal decision. And I would say it's your personal decision when it affects only your health. When it becomes a public decision, when you're getting sick and insisting on your right to go any place you want to go, knowing that it will make other people sick, some who are vaccinated, kids who are under 12 who can't get vaccinated, vulnerable populations that are especially likely to get reinfected or more likely to get reinfected, that your personal right does not extend to making other people sick against their will. And we're going to do everything we need to do to protect the public health. And I applaud those businesses who recognize that a safe and comfortable space is what their customers want and deserve. With 85% of our eligible population vaccinated, that's a lot of people who can return to public spaces. And the safer those spaces are, the more people will return to those spaces, come back to our businesses, our workplaces, shops, and restaurants. It's an important part of our economic recovery, is for the residents of this county to feel safe in the decisions they make. I know that people want to be back. They just need that added assurance that if they come back, they're going to be safe when they come back. And for those who say this is unconstitutional and you don't have the right to do this, I will point out that in Montgomery County and many other, actually in the state of Maryland and many other jurisdictions around the country, they already have mandatory vaccination requirements for students before they can return to school. We're even watching now as folks who missed the last year of school and may not have gotten vaccinations then are now scrambling to get their kids vaccinated for measles and the other vaccinations that are out there. So we've already done this. It's an established right that we have, that this can be required for the greater public health. And so I'm not worried about a constitutional issue with this. In other news in the county, our AAA bond rating this week got renewed by Fitch, Moody's, and Standard & Poor's. They all rated Montgomery County AAA. We continue to be one of the most financially stable jurisdictions in the nation. We are one of only 49 counties in the country with a AAA rating. That's one of 49 out of 3,000 counties in the country. And a AAA bond rating is like having a really good credit score. It enables the county to sell long-term bonds at the most favorable rates, which saves the county taxpayers millions of dollars. We've already done some bond refinancing over the past 6 months or so, and the rates have been nothing less than astounding and have literally saved us millions of dollars. That we've earned a AAA rating in Montgomery County for over 50 years, or for almost 50 years, I should say. And I'm proud we were able to maintain this financial strength even during the pandemic. Since the pandemic started, my administration has carefully monitored and maintained the county's financial position. We were conservative with our projections and estimates as we implemented spendings and savings plans over the last 16 months. We were one of the first jurisdictions, if not the first jurisdiction in the state, to freeze spending and to freeze hiring, because we didn't know where this was going, and we wanted to make sure we could conserve all the resources that we could possibly conserve. We wanted to be sure we weathered the economic storm and we were well positioned to withstand the potential challenges of a post-COVID economy. So I want to thank the Office of Management and Budget, the Finance Department, the County Council, all of them for their commitment to excellence in ensuring that this county continues to be one of the most financially stable jurisdictions in the country. The census data was released this week. Montgomery County is now officially over 1 million residents, the first jurisdiction in state history to hit that milestone. Our population grew by 9.3% over the decade. We've seen a 17.9% rise in the Black population, a 20.7% rise in the Asian population, and a 31.4% rise in the Latino population. as 1/6 of our state's entire population, Montgomery County's demographics, has helped make Maryland one of the diverse states on the East Coast. And finally, is it finally? Yeah. Yesterday I was at Paddington Square, an HOC property in Montgomery County, and I was there to join the Montgomery Green Bank and CEO Tom Deo, Montgomery County HOC Director, Karine Brown, and Groundswell CEO Michelle Moore to launch the county's first community solar project that will directly impact low and moderate income families. The community solar project that was announced is the first in Montgomery County to fall under the low and moderate income set aside of the Public Service Commission Community Solar Pilot. Subscriptions from 30% of the project will benefit low and moderate income households, saving these residents about $500 annually on their energy bills. This is a major residential project, but it's really important because of the intentionality that was put to this, so that the improvements in this building, because adding solar power is not cheap, they made sure that the improvements did not result in the displacement of tenants by pricing them out of their units. So I'm really happy about this, and we believe that this is a model for the county and the Green Bank and our other partners to spread this to other buildings in the county. One of the most difficult nuts to crack so far has been able to do the same thing on a condo apartment. And we are working with PEPCO to remove the obstacles. And if we can do that, we believe we'll be able to significantly expand the range of solar in Montgomery County and move us toward our climate goals. We've been focused in my time here on trying to make policy decision investments that both address equity and sustainability. And projects like this are the model for more to come. And I'll stop there.
Thank you, Mr. County Executive. We do know that perhaps you need to move on to another conference since you're attending the special event in Ocean City. So let's get rolling real quick with the reporters. Jordan Lindsay, my MCM, has a couple questions. Reporters, please, if we can just kind of like move along as quick as possible. Thank you.
Thank you so much. So Elrich, you did mention the resignation of Dr. Gales. Any details regarding if this was sudden, why he's resigning, and who will be taking the open position? I know you did touch on that, but if you can just maybe elaborate a little bit more on how the county feels about all of this.
Well, I don't know how much more elaborate I can be than saying we're really going to miss him. And I thought he was an extraordinary leader, and he's, because I got to deal with him on a weekly basis, so close to talking about all this stuff. I really appreciated, the wisdom and perspective that he brought to this, not just on the health aspect, but also in our efforts to make sure that what we did was equitable. I do not know more than what was in his letter about what led to his decision. So, my feeling is he had a really hard year.
Got it.
And really hard 18 months. And the process of replacing him is a joint process between us and the state. It's a joint appointment of the governor's office and mine. And so we'll work to find somebody, but I am adamant. We're not taking anybody who does not adhere to a science-first approach to this.
Got it. And one quick question for Dr. Bridgers. There's some concerns from some MCPS parents regarding the start of the school year, which is quickly approaching. They have concerns in regards to lunchtime. Have you given MCPS any updates on guidance on how to proceed with the upcoming school year when students and staff are returning?
Sure, that's a great question, Jordan. And yes, we have. Yesterday, we responded to a question regarding not only what to do in the cafeteria, but the CDC guidelines as far as frequent hand washing, spacing, what to do with face covering and guidance and removing all of those things. We will be meeting with MCPS and the independent school system next week just to go over that, to not only discuss MCPS, but those other challenges we have regarding use and individuals, child care and those settings and the guidance. So we're going to go back. We're going to crosswalk all of the guidance that we provided, that MSDE has provided, and make sure that everyone is on the same page so that we can minimize transmission and continue to keep folks in school, which is the direction that we would like to go.
Got it. Thank you very much.
All right, thank you, Jordan. The next question comes from Dominique Maria Bonesi, WAMU, and it is for the county executive. Good afternoon, Dominique.
Good afternoon. Thank you so much, County Executive. Quick question regarding the Cofield Recreation Center and the Recreation Center at Long Branch. I know these are two places that you opened at the beginning of the pandemic for homeless individuals, and now there are calls from the county council that I think they wrote a letter to in July requesting that you find some other accommodation for these people as a new shelter is being built, but not really finished until end of December, early January. Is there another plan for where these folks are going to go and possibly opening their recreation centers for their intended use?
The first thing I want to say is, I listened to the comments and I was kind of surprised that, the tone of some of this, given that they were actually briefed by our health department when this decision was being made, and nobody said anything about it, made any comments to the effect of, we don't think you should use these facilities. We don't want you to go there. So, it wasn't exactly a surprise and people knew about it. And if they had objections that were that strong, it would have been really helpful if, those objections had been made at the beginning when it was in front of them instead of later. I mean, this is really difficult. I think I mentioned this before to people. Our policy in this county forever has been you sleep outside most of the year. And when it gets cold, we provide shelter. And we don't provide, we provide congregate shelter. People live mat to mat on the ground. And in COVID, we had to make sure that we brought people inside, and we had to do it quickly. And we were using a variety of our buildings for lots of different things. And we made a decision, and I think, the wisdom of the decision has been borne out in the sense that we've had very low rates of COVID among our homeless population, which is not necessarily the norm in other places. So that was, in our minds, a really important success for us. We are looking for alternative locations, but it's not as easy as some people think. There are hotels that will not take homeless people. There are hotels that might take a few, but won't take a lot. You just can't put homeless folks into a hotel. You have to continue to provide services. And it's hard to provide services and monitoring when rooms can be scattered on different floors of a hotel. In our living centers and our shelters, there's an ability to have people there who can work with and monitor the situation in the shelter. That becomes far more difficult and requires far more people to provide the same level of monitoring when people are in closed rooms and on different floors. So between reluctance of hotels to do this and some of the extraordinary costs attached to it, we are looking for other solutions. And I have a number of things that I've put on the table to my staff, and my staff has told me they have a set of suggestions, and I'm going to look at them very carefully. My goal is to implement this as soon as we can implement it and move people. We'll have a permanent facility around the turn of the year, and I'm looking at more permanent facilities, because the permanent facility will, first of all, just replicate congregate care, so people won't have privacy or rooms, so to speak. And it doesn't serve everybody who's homeless. And I think, in a county like ours, we need to actually figure out a real solution where we can take people off the street, put them into a setting where they get access to food, where their medications can be monitored, where they can get help and guidance from people who are there to help and guide them. And we need a comprehensive solution. So we will work on something short-term, and we're going to work on something long-term.
Just one quick follow-up. You said in the short term, when you say short-term, do you have a timeline on that?
I don't have a timeline until I have my meeting and they tell me what things they think they can do and how quickly they think they can do them. When I know that, I'll have a good sense of what that timeline is going to look like. So we should know. By the time I meet with you all next week, I should have a better answer of what we're doing and where this fits in and how we'll get implemented.
Thank you, Dominique. Thank you, Mr. County Executive. Next question, Randy Bass, WDVM. Randy?
Thank
Good
you all. I'll
afternoon.
make it quick. Dr. Bridgers, my main questions here today, nearly 170 million Americans are fully vaccinated, but will the addition of this third dose change the definition of what it means to be fully vaccinated going forward? And I have to ask about the other Americans who got the 1-dose Johnson & Johnson shot. What do we know about what's next for them?
So Randy, great question. The CDC has advised that with the variants in the community, that a third shot is needed to strengthen the immune system, and they've identified a post 8-month vaccination period. And regarding the Johnson & Johnson, the data have come back and is inconclusive now. The recommendation is for those individuals who receive the Johnson & Johnson that they follow up with their primary care physician when we get more data. And as Mr. Elrich indicated, that is our basis for many of our decisions, if not all of our decisions. And we will continue to use that as our guide. The Pfizer and Moderna are available. I'm sure you read some stories that had some questions about the Pfizer vaccine. And so we will continue to use the data that's available with our EPI team and our surveillance team and what we receive and guidance from the CDC, and if and when the state provided. That's our current course of action.
Thank you, Dr. Bridgers. Thank you, Randy. Stephanie Ramirez, Fox 5. Hello, good afternoon.
Hi, good afternoon. Quick question here on the Quince Orchard football situation. The program had paused all of their football operations after at least 6 people had tested positive recently. Can you please explain what the guidance is on how many players or members test positive before the program shuts down, and what parents should expect to see moving forward in the schools as well? If 6 students test positive or members or staff, should a whole school shut down, or is that what to expect?
So great question. An outbreak is considered one or more cases. We are contact tracing those individuals, and the football team, the guidance is for them to isolate, quarantine, get tested within 3 to 5 days. The parents will be notified. MDSC sent out guidance for those individuals who are fully vaccinated versus those who are unvaccinated. If they don't have COVID-like symptoms or flu-like symptoms, there's additional guidance for 10 days. After 7 days, if they aren't positive and have a fever, they can test out if they are positive, and that's the course of action that we are following now. MSD released guidance on the 23rd of July. They again released guidance on last Friday on August the 13th, and we are looking at all those guidance. They have a decision matrix, and our contact tracers are also talking with the state and looking at that guidance, and more importantly, how that impacts not only schools, but families and the MCPS system as a whole.
So for the parents who are like watching right now, especially those concerned that their sports team, their child's sports team could be shut down at any moment's notice, can you just give a number? Like what is that guidance and what to expect if a sports team should be shut down or if the school should be shut down? If one case is considered an outbreak, that doesn't help anyone here, right?
So if one person on the football team is tested positive, or the whole team is tested positive, that entire team needs to isolate. So that's the numbers. I don't know how many folks who tested positive, or if it was one. I did receive some information yesterday regarding that, and I haven't received an update from our contact tracers. Those parents and students and the school has been notified. They will go through the guidance that we have from CDC and MSD and follow up. If they tested positive, today is Wednesday, if they tested positive yesterday, then they would go through that isolation or quarantine period based on close contacts, which is less than 3 to 6 feet. And so that's pretty much the guidance that we are recommending now, based on the information that we have.
Thank you. And a follow-up to that, we're hearing a lot of concern from parents who want to know if the kids on the team are vaccinated. Is the school system disclosing that information? If not, why not?
So due to HIPAA violations and contact tracing violations, unless there's a need to know, our contact tracers have that information. And unless there's an immediate need or risk to the public, I doubt if that data will be shared. It is to safeguard and protect not only those students, their parents, and the school themselves.
Thank you so much, Stephanie. Thank you, Dr. Bridgers. We believe you do have to go, Dr. Bridgers. It is 1:32. Mr. County Executive, can you remain on the line?
I can stay with the county executive as long as he's on. I mean, some of the questions
Okay.
I may be able to ask on behalf of public health, so I would just be delayed. But
Okay.
so let's continue.
Let's move forward. Corey Smith, NBC4. Hello, Corey. Good afternoon.
Good afternoon, everyone. Question, Dr. Bridges. I know you said that you're meeting later this week, and formulating your plan in terms of getting that third dose out. But anything else, should people expect to see mass vaccination sites reopened? I mean, we all did tons and tons of stories about the crush of folks trying to get vaccinated, parts of this. Now those folks 8 months later are going to be kind of on top of one another again. Anything you can tell us there in terms of how the county could handle this kind of potential rush of folks?
Sure. Great question, Corey. We have a couple of plans in place. We have the immunocompromised plan. We have the individuals who may be eligible after 8 months, and we have a plan for those individuals if mid to late winter for those individuals under 12. And so we've presented Mr. Elrich with those plans. And so how would it look? We have the data, we have the information from Immuned and PrepMod to identify those individuals. And when we started with those long-term care facilities, those assisted living facilities, our healthcare professionals in partnership with the CVS, the pharmacies, and the hospitals. And so absent of having a mass vac site, we will use that data. We projected based on those numbers, the increased vaccination range would be from October through maybe January, identifying those individuals. We have to include our seniors, those individuals who are 80 plus, 75 plus, 65 plus, based on our phase approach, and then those individuals who are homebound. So in our plan, we have those projections based on the CDC guidance, and we're going to follow that plan with those numbers. Now, the unknown variable that we don't have is those individuals that went out of county, and so we have to work with the state and our local jurisdictions to identify those individuals. So that's pretty much the plan going forward. Those individuals who are immunocompromised, I gave the numbers, and we're going to use that as a basis. But most importantly, those individuals should check with their providers first, so to ensure that there's no contraindications regarding a third shot. And so that's pretty much what we're seeing in the literature that we're reading from our syndromic and surveillance data, our epidemiologists. So all of those variables are into play regarding our plan. And we have a plan in place, and we're going to go forward similar to what we've done before. The great thing about this, Corey, is that we've used the lessons learned from our effective planning for not only testing, but vaccinations to get us to a point where we have 72% of our population vaccinated, even when Dr. Gales received 64 test kits back in March and 2020. And so we've come a long way. We've used those lessons learned, and we remain resilient and forward in our thinking.
Thank you, Corey. Thank you, Dr. Bridgers. Let's move on to Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Good afternoon. This is for either Dr. Bridgers or Marc. Just moving forward, how is this situation with the joint appointment with the state and replacing Dr. Gales? Do you submit some names to them? I mean, just from the county's perspective, how is this going to proceed, I guess?
Dr. Krell, I don't know if he's on the call, is going to work with the state, and we jointly have to come up with a name. So it becomes a joint project of us and them, and we'll get the vet names. I'm sure the state will be vetting names, and we know what our minimum standard is pretty clearly.
Dr. Bridgers, are you interested, just given your current role?
Well, based on the COMAR regulations in Montgomery County, since it's a home rule county, their health officer must be an individual who has a medical background. My background is in public health. I'm a research scientist in public health. And so if there was another county, the smaller counties, or those individuals who are not home rule, the deputy health officer or the acting health officer who is non-medical could serve, and the deputy health officer would be a medical deputy. I will continue to provide the best science, knowledge, efficacy to Mr. Elrich and our team. Our team is a cadre of trained professionals, research scientists, and clinicians, and we've made significant and successful strides. I will continue to be the conduit and stand in the gap until a medical officer is hired.
I'm sorry, are you saying you're not eligible? I apologize. That's probably a dumb follow, but are you not eligible then, or what are you saying?
I'm not eligible because I don't possess a medical degree.
Okay, that's what I thought. Thank you.
Thank you, Steve. Thank you, Dr. Bridgers. Kevin Lewis, ABC7. Good afternoon, Kevin.
Hey, good afternoon. County Executive Elrich, what country is Dr. Gales currently vacationing? And I had a few other follow-up questions.
I'm not totally sure. It's in Europe. I'm guessing France, but 6 hours could be a number of different places.
He's in France.
In France. And why did he choose to resign today? I know there's been a lot of burnout in a lot of careers. Clearly, as you said, he's gone through hell. I can't imagine how many hours he's clocked every single week. Do you think that while on vacation, he just kind of had this aha moment that other people have had and said, there's a next chapter for me, and it's just not here in Montgomery County, despite all the good I've done?
It's hard to say. I honestly don't know. Hopefully when he gets back and I can talk with him, I'm not going to interrupt his vacation and just figure out, what he's got planned. But I do think, this has been hard on a lot of people. I've watched a lot of senior people, you read about this in news stories about senior staff and, just deciding they want to do something else. I mean, you've done this. It's like, is life always going to be like this? So I totally understand, and I've had to think about how other people feel about their situation in life. And I think, whatever he's doing, he's probably he definitely has a good reason for what he's doing. But this has been a hard place to be. I mean, if I had to fight with my boss every day, and I had to not just fight, it's one thing you fight and you lose, and that's life. But when you have to make decisions that are contrary to what your boss is saying you should make, that's a really difficult thing to do. And I anticipate that may well continue for a while, given this isn't going away anytime soon.
When you got that email, I'm not sure if you were woken up in the night, but when you got it, your reaction was
I was sad. I was sad. I mean, I feel like he's really played an important role here. My first reaction was, thinking about what he's done for the county and how important a role he played. I always made sure that he and Dr. Bridgers, got to be center of these discussions around public health, because I wanted to make sure that people heard from the medical side of this, and not a political side of this. And I know that a lot of people thought his clarity and his, frankness about things helped them understand what we were doing. I think even the media corps, found him, refreshingly frank. And that's because he was independent enough to be and willing to assert his independence. So, it's a loss for the county. It'll be a gain for somebody else, but it's part of life.
Final question. Do you have any idea what his next chapter will be?
No, like I said, I haven't talked to him. So if I had talked to him and I knew where he was going, I'd be able to tell you something. But right now I don't know.
All right. Thank you very much.
Thank you, Kevin. Thank you, Mr. County Executive. One more follow-up to wrap this up from Stephanie Ramirez, Fox 5. Stephanie, very quickly, please.
Thank you. County Executive, just a follow-up question for you, because I know our office had reached out in regards to the unmasked photo that Congressman Trone had tweeted out. But I want to ask, because you had just mentioned your concern, especially with the governor and the lack of mask mandate in Ocean City, why we saw you at the top of the news conference without a mask indoors, and I believe you are in that area?
Because that was like maybe a minute or two when I had taken off the mask. I had been speaking, I took off the mask, I sat down, and as soon as I looked down at my hand and I realized the mask was next to my hand and not on my face, I put it back on. That's what happened. It happens to lots of people. I mean, it'd be different if I was walking around that, and if you saw the other photographs, every other picture in every other part of that building, I'm wearing a mask, as is everybody else. But, you know, when people spoke, some people take off their masks. We let it, you know, when entertainers do their entertainment, we said, you're not required to keep your mask on. It went off for a minute and it went right back on.
Thank you for that. But also, why the concern for Ocean City when we just saw you at the top of this news conference without a mask on indoors? And I believe you are in that area.
Because I'm in a room by myself over here. When I'm out in the halls, my mask is on. I'm trying to be clear and have people understand what I'm saying. The mask and speaking through my iPhone and the computer is not exactly conducive to doing that. So when I'm inside this room here, a rather large room by myself, I don't feel bad about it. But as soon as I go back out in the hall, I've been wearing a mask. I wore a mask all the way through the meeting with the governor's staff. And we try to do this, you know, a matter of course. I feel comfortable with it. And I'll be wearing it all the way down here.
Thank you.
Stephanie, just to add, our Board of Health regulation does afford a speaker to remove their mask indoors at a public space. I met with our level of approval authority this morning, and there is an exception. So if the county executive is out speaking indoors at a church or another facility, the Board of Health regulation allow for that, or any other speakers. Once they are finished speaking, they will don their mask and continue. So I just wanted to share that as an additional item.
Thank you both.
Thank you,
And
Stephanie.
frankly, I do wish, given the levels of transmission down here, that they actually had mandated the mask in Ocean City. I mean, these numbers on the Eastern Shore are really high, you know, much higher than Montgomery County. So it's kind of weird looking around at all these folks who aren't masked.
Thank you, Mr. County Executive. We know you do have to go. Thank you, reporters, especially for your patience today with the technical difficulties. Stay safe. We'll see you again soon. Good afternoon.